Who is the king or queen of weight loss medications? Let's turn it over to our expert.
Hey, this is Dr. Reyes, weight control medicine. Questions I often get from patients regarding the differences between the diabetic versions and weight loss versions. I understand that patients are sometimes reluctant to believe that there are the same medication. So you can see right here on this slide, these are the injectable medications for weight control, not necessarily FDA approved because of how they're developed, but they do cause weight control or weight loss. So these will include both the diabetic versions and also the FDA approved versions for weight control. So let's start with the first one there, Saxenda. Saxenda is also known as Victoza. The generic name is called liraglutide. So what's the difference between Victoza and Saxenda? First of all, they're made by the same company, Novo Nordisk. Their delivery system is exactly the same. It's a multi-dose needle. The difference is the dose. So Victoza would only go up to 1.8 milligrams daily. Saxenda then came out years later in 2014 as the weight loss medication, and it went up to 3.0. Novo Nordisk tested it at a higher dose, got the approval for weight loss. I don't know if anyone really Victoza anymore for diabetes, just because the weekly version is so much superior. So the history of Novo Nordisk, the company that made Saxenda and Victoza, then came out with the weekly version in response to Lilly's Trulicity, and they came out with Ozempic. They geared it towards diabetes first. So what's the difference between Ozempic and Wegovy? They're exactly the same medication made by the same company. The delivery system is different. Ozempic is a multi-dose pen, and it only goes up to 2.0 milligrams. Wegovy, the weight loss version, goes up to 2.4. Novo did the same play. They started with diabetes, and they said, oh, that causes weight loss, so let's focus on weight loss, so let's retest it at a higher dose. Everyone started moving towards the single injection strategy. So Wegovy comes in 4 pens per month and it's single injection. So it's a different delivery system, same exact med. Do I have patients who tell me, oh, I felt different on Wegovy than Ozempic and Ozempic or Wegovy? That's more of a perception issue. They're exactly the same medication. They're made by the same company. It's just delivered differently and branded differently, but they're exactly the same, with the dosages being slightly higher for Wegovy. So the history of it then, during that battle, during the time of Ozempic and Wegovy, Novo Nordisk and Lilly were fighting over the diabetes space. And Lilly had come out in response to Victoza with a weekly diabetic version called Trulicity. Trulicity was a single injection pen. I didn't even put it on there because the weight loss on it is so weak and the medication would run off by day 5, and they had no weight loss indication with Trulicity. And so once Ozempic came out, that became the go-to. I called it King Ozempic for the longest time because it was far superior than Trulicity. But then Big Lilly came in and decided to beat up Novo Nordisk with Mounjaro. Mounjaro came out, single injection pen, and tremendous weight loss in their trial. Their big headline was achieving 21% or 20% weight loss, which is on the same level as gastric bypass. So they call it the non-surgical solution for weight control. Mounjaro came out for diabetes first, people using it for weight loss. Lilly was smart and got Zepbound approved a year later in 2023. Mounjaro was approved in 2022. Pretty awesome. Is there a difference between Mounjaro and Zepbound? There's no difference other than the FDA approval. The medication is exactly the same. Is there a difference between Ozempic and Wegovy? The only difference is the dosing. How high can you go? And the delivery system is different. Ozempic is the multi-dose pen, which I love. And then Wegovy is the single injection pen. Mounjaro and Zepbound actually use the same delivery system as Trulicity. It's that single injection pen. It's the same pen. Unfortunately, that's one of the causes of the shortages of the medication is the single injection pen. Hey, Lilly, if you happen to be listening to this video, consider releasing to the US the multi-dose pen that you've released in UK or in Canada. I would really appreciate it as a physician that we would have a multi-dose pen of Mounjaro or Zepbound here in the US, and maybe that'll shut down on the shortages. That would probably make things easier for my patients. If you're listening and Novo Nordisk, please go back to the multi-dose pen. It makes things a lot easier when we're dealing with these shortages. Leave your comments on the bottom. I'll see you at the next video.